Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and if you follow our channel, you know that I'm a cosmetic facial surgeon in Richmond, Virginia. I only do cosmetic facial surgery from here to here, and I don't do boobs, bellies, and butts. So I talk to people all over the world from YouTube because we have so many videos and so many views, and thank you for everybody that participates. I actually spoke to a plastic surgeon today in Mongolia and answered a question. One of the things I've been seeing lately is people have asked a lot about evaluations, like facelift evaluations, eyelid evaluations. What happens at these evaluations? How do we do it? So what we're going to do is we're going to go into an actual evaluation and show you what we do. Okay, and the patient has allowed us to do this, but we really haven't rehearsed it or anything, and so we'll show you the real deal, although I will be talking to the camera a little bit, which I obviously wouldn't do if we weren't filming it, but I hope this answers the question. So hang tight, have a seat, and this is going to be a little longer video, but it's the real deal, and we'll show you how we evaluate facelift patients. I'm Dr. Joe Niamtu, LoveThatFace.com. So we get the question, what happens at a facelift eval? I'm going to show you with my friend Lucy here. How we doing, Luz?
Doing great.
Good to see you. I'm Joe. Thank you for coming in.
Yeah, thank you, Joe.
We're going to film today, if that's okay.
Yes,
All right.
absolutely.
All right, very good. What do you do for a living?
I'm in real estate.
All right, very good. Well, we're going to sit down here. We're going to talk about what bothers you and your options, all right?
Okay, sounds
all right.
great.
So thank you for coming in. What we're going to do today is we're going to go over your facial aging changes. I'm going to tell you what you have, what your options are. I'm just going to give you a menu. This doesn't mean that you have to do it or you want to do it, or, you know, and obviously this is a consultation, so we're just going to talk, okay? And you just relax, because sometimes it's kind of hard to talk to people about the stuff that bothers you, like my bald head, okay? All righty. So we're going to start at the bottom and work up, because you tell me, when you look in the mirror, what are the things that you see, you know, when you're at home and everything that bother you the most?
More my eyelids,
Okay.
And I've been having a little bit of vision problems, so I saw the eye doctor and they recommended that most likely I'll eventually have to have that done, and they tend to get a little bit heavier too.
Put your mirror down, that's okay.
And then also here is starting to droop a little bit, and I'm sure this face is hereditary. My mom, I see it in my mom, and I really kind of want to try to nip it in the butt before it's too bad.
Yep.
So I think really just more of freshening it up.
All right, well that makes perfect sense, and that's the perfect patient, okay? Because we have people that come in here and they want to look like Elvis or Lady Gaga, or
I don't want to look like Frankenstein.
they're 19 and they want a facelift. So my best patients are the patients that say, hey, you know what? I look in the mirror and that person looks older than I feel, and so far everything is good here. All right, well let's just do some talking here, and Breeden, you can zoom in here a little bit so we get her face. Now, what I want you to do, I'm going to talk about this, and I'll let you look in the mirror so the viewers can see what we're talking about, okay? So basically, everybody clicks along well until they're about 50. So if you went to your high school reunion and you're 50 years old, people are going to know who you are and everything. But once we get 50, things start to change. And one day you look in the mirror and you look more like your parents, okay? And once that happens, it accelerates and it starts happening fast. So this area, in this area, from when you're 50 and between 50 and 55, there are usually big changes there, okay? Now, normally, and I'll let you look in the mirror in a second, but we're just gonna do this, and Breeden, you zoom in for me. So when we're young, we have higher cheeks and we have a tapered jawline. As we age and this comes down, we lose cheek volume and our tapered face becomes square, because this droopy skin and muscle and fat and everything else descends, and then we have this square face, we have jowl formation, and we have this extra neck skin, okay? The only people that don't get this are people that aren't alive. And we are a product of birthdays and a product of heredity, all right? So everybody's going to age, all right? Now, what I am going to show the people watching the video, and I'll show you in a second, is what does a facelift do? Okay, so above the jawline, a facelift does this. It resets your cheek, it helps your fold in the corner of your mouth, and we really work on this jowl. There's 4 special things I do to reduce the jowl. So that's what it does kind of above your jawline, but it doesn't do this distortion where my finger is. Below your jawline, it does this. Now in a minute, we're gonna lay the chair back and show you and everybody what it does. So if you look in your mirror real quick, above your jawline, this is kind of what the facelift does. And remember, I'm going after that guy right there and flatten it. And then you have a really nice profile, so it's gonna do that, okay? Now you can put your mirror down a second. And this is really important. 2 things that are really important here. A facelift, and Breeden, are we both in the video? And I hope the people that are watching don't mind me talking to my video nurse here, but I want to make sure that everybody can see everything. There's 2 things that are really important when you talk about a facelift. First of all, it's effective from here to here, okay? So a facelift is basically for your lower face. And it does nothing in this area. So it doesn't help wrinkles around your mouth, your nose, your eyes, your brow, all right? And if you try and make a facelift do more towards the center of the face, that's when you get this really creepy looking stuff that doesn't happen in my practice, okay? So you are a candidate for a facelift. And what we're gonna do here, now we're gonna lay this chair back, and Breeden, you just stay where you are. And I'm gonna show you, so after doing over 1,500 facelifts, I think this is a pretty accurate way to show somebody what they would look like. So I hope we have a good view here for the people that are watching. And now what I normally do, and this is, I'm gonna have to do this a little differently because we're filming, and so I need the patient to look in the mirror at some point, but if she does that, it's gonna block your view. So what I tell people is, this is what we're fighting, this skin right here. And that is the excess that we're gonna take care of. So I want you to look in the mirror a second. And even if it, yeah, all right, so can you see that? So this is the jowl and the neck skin and the jaw skin, and that's the skin below your chin. Now, I want you to put your chin way up in the air, okay? And now, when you do this, okay, and again, after doing 1,500 facelifts, I think this is the most accurate way to show somebody what they'd look like with a face and neck lift. You know, some doctors do computer imaging, and really that's just kind of like a cartoon. You can make anybody, you could put hair on me, you could do anything you want. And I don't like it because it's just a computer rendition. But I think this is how people are gonna look. So when you sit back like this, you have this nice tapered jawline. Now put your face down, your chin down, and when you sit up, this is when we have this squareness, okay? So put your chin up again, all right? We have a nice tapered jawline, and we have fuller cheeks. If we look at our neck, put your head down again, we have all of this extra skin, and if you put your chin up, okay, that goes away. So that takes the skin out of the equation, and you probably have, look in your mirror a second again, you probably have a couple tablespoons of fat there, so we'll make your profile even better. But you like the way that looks? Okay?
Yep.
Your cheeks wouldn't be quite that big. Gravity pulls them back a little bit, but this is a pretty accurate rendition. Remember, a facelift is effective from here to here, and it doesn't do anything in here. Okay? Okay, so sitting back up here in a little recap, a facelift is from here to here, doesn't do anything in the center. It's gonna do this above your jawline. It's going to do this below your jawline, and in a combination, it's going to do that. I really, really think, with decades of experience, and that what I just showed you, that prediction is accurate to what you'd look like with the face and neck lift. Okay?
Okay.
All right. Now we're going to look at your eyelids a little bit. And again, when I'm doing this with a patient, they're looking in the mirror. But if she looks in the mirror, it's going to kind of block the view. So you can hold your mirror out there and look a little bit. All right. Now, if you hold this mirror up and look up, you can see the fat bulges there, okay? So that is fat that protrudes as we age. Some of it's heredity. And what we do is I use a laser and I make an incision inside your eyelid so there's no scar. and I remove that extra fat, and then I laser that skin, and we'll make that nice and flat, okay?
Okay.
All right, on your upper lids, close your eye for me a second, and we're gonna drop the mirror for a second, just go to the camera. On your upper lids, open your eye, okay? Are you able to see that? So we have this extra skin here, and this is what drives people crazy. And so we have several options. We can do a brow lift, which obviously elevates the brow, and then we would still take some skin away. Personally, look in your mirror a second, I don't like that. That's a little extreme for you. So your brows are in good position, so we're just gonna take away this extra skin and muscle and fat, okay? So we've talked about your neck, your lower face, your upper face. Let's talk about your mid face. So if we reposition this, you're gonna get that much cheek. And if you wanna look in your mirror, you can. So you're gonna get that much cheek. If you want more cheek, then we frequently do cheek implants, or you could do filler, but implants are a nice procedure because they're permanent and they're reversible. You can take them out or change them if you wanted to. And when we talk about this stuff, I'm going to talk about the face, which I have done in 3 sections: lower face, mid face, upper face, and then the skin. All right, so those are the 4 things. So what I tell patients is when we do surgery, facelift, eyelids, cheek implants, that's like, it's like rebuilding a car and doing the body work, or doing the frame on a couch that you're restoring. And when we do a laser or a chemical peel, then that's like painting the car or upholstering the couch. So that takes care of the outer layer. So you've got a good bit of typical brown spots, aging spots, sun damage. So you're a candidate to do a full face laser or a chemical peel. Sometimes we do that at the same time of surgery, and sometimes we do it as a separate procedure depending on what we're doing. So basically, you have, how young are you again? We didn't say that.
I am 54.
54, okay. So you have age-appropriate changes, all right? And most of your friends probably have a similar situation, and if they don't, they will, okay? Mm-hmm. So if I was teaching a class, and I guess I kind of am a little teaching here right now, you are a candidate to do a comprehensive deep plane face and neck lift, okay? I would take some buccal fat out here because you have very, very full jowls, so I would take out a little buccal fat. If you wanted to, you could do cheek implants, and that's not a big deal. This is the cake, that would be icing, okay? And we talked about doing your lower lids, which is called transconjunctival approach, where we're doing it from the inside and lasering that and taking this extra skin, muscle, and fat off of your upper lids, okay? So that's your menu. Facelift, cheek implants if you wanted to, upper and lower eyelids, and chemical peel or laser. Now, when we go over this with people, I do this all day long, okay? I'll do this 5 times today. I'll have the same conversation because people age the same way. So it's crystal clear to me and to my staff what we're trying to express. But you have a patient that walks in off the street, they're a little bit nervous because they're talking about all this stuff, and here I am, I'm spouting out all this stuff about lasers and cheeks and facelifts, and so it can be confusing. So what I like people to do, number one, is to look at my webpage before they come in. I have hundreds of videos. I have literally over 10,000 before and after pictures on my website, and that will educate them. So patients like yourself that have looked at my website and studied this, they have such a better understanding of what I'm talking about. In the old days, before you had all of social media and web pages, consults took a lot longer because you had to explain so much more, okay? And it's really important to me that my patients understand what we're doing. And I give everybody my cell phone and email, as you know. And our best patients are the ones that are educated, understand what we're doing. Now, what's important to me is I named 5 or 6 things that you could do Doesn't matter to me what you do. I don't care. I love coming to work, and when I scrub up and get in my gear and we're in the operating room with my wonderful staff, I don't care what we're doing because it's fun. I have a good time. What I do care about is I'm doing what the patient wants, okay? So a lot of patients will come in here and they say, hey doc, you got one shot at this, okay? So you better do everything. I'm not coming back. And we do multiple procedures. And other patients, they're much more conservative and they say, well, I'll do the facelift and maybe a chemical peel, and I'll do my eyes later or my cheeks later. If you have a doctor that's pushing you, you've got the wrong doctor. You do what the patient wants to do, not what the doctor wants to do. Also, I mentioned I give you my cell phone and email. If you have a doctor that you can't get a hold of, then you chose the wrong doctor, okay? So these are just some of the important things. Every single patient that comes in here has the same question. I don't want to look like Kenny Rogers or, a lot of these celebrities that have distorted faces and everything. And I can promise you, you won't. You'll look like you did when you were laying down. Does that make sense?
Makes sense to me.
Okay. So basically, for the facelift, we want to make sure you're in good health, so you'll have a physical, so we can document all of that. We want to make sure you're not taking anything that makes you bleed, aspirin, Advil, fish oil. A lot of people take fish oil. That can make you bleed. We'd like you to start taking a prenatal vitamin before your surgery, and we want you in tip-top shape, okay? So, patients that have, even if they have like diabetes or hypertension or other, if it's controlled, it's usually not a problem, but I never take chances, okay? And there's two things that I have to do to be successful for you and for me. Number one, you have to be safe, okay? That's above everything else. We have a fully accredited surgery center. I have full-time anesthesia. I've got the best staff in the world. They're so trained and compassionate. All I do is stuff from here to here, and I do a bunch of it, okay? So I feel really good about your safety. Number two, and I'm going to say this selfishly, okay? If you don't look good, I don't look good. So patient safety is number one, natural results number two, okay? Got to have those two things. So obviously, frequent question is, what's the recovery, all right? It's very important that you have a caregiver, somebody that's, can be with you for at least 2 days to help you with medications and everything. And usually I don't use drains unless somebody has increased oozing or something like that. So it's doubtful that you'll have a drain. When you wake up, you'll have an ACE bandage, little head wrap on, okay? And you wear that for a couple days. You can take that on and off. You'll be able to shower the next morning. We want you to eat soft foods and just basically take it easy, okay? The pain is generally not that bad with the face and neck lift and the other things that we're doing. You'll be a little beat up, for sure. And we'll see you in the morning, the following day. So about 56% of my facelift patients last year, I did about 110 lifts, and 56% were from out of town. So since we see so many out of town patients, I'd like to keep them here at least 5 or 6 days, okay? For patients that live in the city, we would see them the next day, then we would see them in a week. So basically, I have patients that at 6 days, 7 days, they're feeling pretty good. If they want to sneak back into their office at work or work from home, they can do that as long as they're not bending or lifting, okay? You'll be on your phone and your computer the next day after your surgery. You can take a shower, wash your hair the next day after your surgery. You have to work a facelift into your life. If you try and do it the other way around, you're going to be unhappy. It's going to put stress on the patient and on the doctor. So you got to carve out a good 2-week period for this, okay? Now, most people, talking about recovery, at 2 weeks, most people are going to get out of the house, okay? Women can wear their hair down. I would be in trouble, all right? But, and cover everything. Now, this is not 2 weeks before your class reunion, okay? If somebody has an important event, I'd say, do it 4 to 6 weeks early, all right? I don't even take final pictures till 3 months. And quite honestly, there are little changes that go on with face and neck lift that can take a year, little tiny things. So, it's something that you just want to get as much information as you can when you're looking for a doctor, which hopefully you already found one, but you want to find somebody who's board certified in their discipline, who does a lot of face and neck lifts, who has a fully accredited surgery center, who is available, somebody that you feel good about, that you can talk to. And, you know, experience is so important. The facility, accredited facility for sure, and such a great staff like I have. So it would be my honor to be your doc, okay? What questions do you have?
I think the main question probably would be swelling and bruising, and you know, those would probably be the key thing, especially with the eyes.
Sure.
You know, how long that would last.
So you are going to swell. Bruising is most people don't bruise, some people do. And you know, I can tell you with accuracy about anesthesia, about anatomy, about medications, about incisions, but how you're going to heal versus the other people I do that week or that month or whatever, it's all across the board. Some people say they bruise a lot, they don't bruise at all. Other people say they never bruise and they bruise. You're gonna look a little beat up for that, you know, first week and 2 weeks, but it's manageable, okay? And we are here for you. You have my cell phone, and you know, it's not like we operate it on and kick you out, okay?
Well, I've been following you for years and knew that this day would come at some point. And watching all of your YouTube videos and seeing all the different results from all the different patients, and whether it's what I thought I would have to have done. But it seems like with the staff just being here in a short period of time, like they're amazing. You've described everything that I needed to know, and I feel like I'm at the right place.
Well, as I said, thank you. It'd be my honor to be your doctor. And you know what? I love doing this. On Sunday night, I'm really excited about coming to work on Monday, being with my staff, seeing all the crazy things that they did all weekend, and doing surgery. You know, surgeons like to do surgery. It's fun. So I'm one of these people that I just love going to work, and I'm going to do this. One day, I guess I'm just going to fall over, and they're going to say, "Yep, he's dead." But I intend on doing this a long time, and one of the best things about it is having great patients like you. Thank you so much. All right? And I hope you enjoyed this. I really want to thank her because she kind of walked into this cold, and not everybody will let you do this. But this is how we do it. I hope you enjoyed it. I want to thank our camera person, Breeden RN, and I'm Dr. Joe Niamtu, lovethatface.com.